So good morning, everyone. My name's Shazia Khan, and the unit we're doing today is health and social care provision. And the learning outcome is the final learning outcome, which is learning outcome 4. Can you all see these slides? It's understand the implications of ethical and legal issues within health and social care.
Yeah.
Yeah. Okay. Mugaranis, can you see this? Okay.
Yes.
Okay, excellent. Thank you. So I'm just going to give you, before we start on learning outcome 4, I'm just going to give you an overview of what we did in the last session, which was learning outcome 3, which is to understand inequalities in health and social care. Things like, age, sex, hereditary factors, lifestyle and social and community networks as well. It might be things like environmental factors, whether the person is, from a different social group. Well, does anyone remember, Nancy, what we looked at yesterday in learning outcome? What different social groups do we have? We looked at vulnerable groups, didn't we?
Yeah, we did.
And what is vulnerable group?
The people who really can't do without help.
Yeah. So vulnerable group, was it we looked at homelessness, remember?
Oh, yeah.
And we looked
Okay.
at sex workers and gypsies
Yeah.
as well, travelers,
Sex
and how
workers,
that community,
travelers, asylum seekers,
and
all
how
those.
they are affected by, inequalities within health and social care. We also looked at common health determinants such as genetics, environmental factors, lifestyle factors. What could lifestyle factor be?
Like their lifestyle, like they are homeless,
Yeah.
they are drug addicted, or those
Yes,
stuff.
drugs addicted, drinking. It could
Yeah,
be anyone that's
alcoholic, all that.
smoking drugs.
Yeah.
Their lifestyle has an impact on health determinants and the healthcare access. That's a big one as well. Maybe, they don't have access to healthcare, which is an inequality. We also looked at key determinants. We looked at health and well-being. So we looked at race and ethnicity, gender, the regional side of it as well, the rural housing. We also looked at social class, and gender, geographical region. We looked at people that are disabled, old people, vulnerable people, things like, maybe people that are vulnerable, like sex workers and migrants and things. So we looked at that in learning outcome 3, and we looked at the inequalities, how they can impact on, how could that have an impact on the health and well-being of that individual? Vida, hi Vida, you're on as well. And Mugarazi, how could it have an impact on all these inequalities that are happening? How could they have an impact? Do people get the right treatment then?
Some areas, some people they don't get enough funding.
Yeah.
On to get the right treatment and stuff.
Yeah.
Like elder people, they tend to ignore them than younger ones.
Yeah. So we looked at social class, things like that. That was learning outcome 3. Now we've gone on to learning outcome 4, which is the final learning outcome. Then next week is your assignment discussion session. So the learning outcome 4 is to understand the implications of ethical and legal issues within health and social care. And that things like ethical issues, they're really important for maintaining that patient well-being and ensuring professional accountability as well. And it could be ethical context, confidentiality, duty of care. You have a duty of care to an individual to make sure that everything is dealt with properly. We look at key legislation, Human Rights Act, why that's so important in regards to it. Policy and codes of practice, why policies are used and codes of practice. And also looked at the Nursing and Midwifery Council and the British Association for Social Workers. Key terminology, so what is ethical? perspective in counselling. Sorry, in health and social care. So ethical, what does ethic means to you when we talk about ethical things? What does the first thing that comes to mind? Nancy, what are the first thing that come to mind for ethical?
The religions,
Sorry?
religions.
Religion, okay. Mugarazi, what's the first thing that comes to mind for you? Ethics, principles of ethics.
The ethnicity. Right?
Ethnicity, okay. Vida? Vida, can you hear us? So it could be things like, respecting people, respecting their decisions, autonomy, giving them that patient autonomy to do things themselves, and making sure that there's autonomy, making sure that there's beneficiaries, that you're doing it in the interest of the person. Confidentiality is a really important bit. That they respect the patient's privacy and keep their personal information confidential, maintaining that all their personal information is not shared with everyone. It's shared by individuals who are receiving the care. Fidelity is the principle involves being faithful, making sure that you have why is it important to have a faithful and committed, maintaining a relationship of trust with them? Why do you think it's so important to maintain that relationship of trust?
It makes them feel safe.
Yeah.
And
Do you think it makes them feel that they're able to open up?
Yes.
Yeah.
It does.
Oh, why do you think that's so important in terms of a patient and a doctor?
They, when
They
they
will-
open up, they get the right treatment or the
Yes.
right help.
Yeah. Mugarazi, what's yours?
Yeah, that's what I was going to say.
Yeah.
If they open up to the doctor, which
Yeah.
means they trust them, they
Yes.
will tell them.
And that's a really important part of it,
Yeah.
isn't it? The trust issue, the relationship of trust with them is really important.
Yeah.
The next one is to understand the implications of ethical and legal issues within social care. So, ethics is not just about understanding them, but it's a crucial part of any sort of health and social care, because it has a big impact on the individual and healthcare and other organizations. And it can, if not done properly, it could there could be repercussions. And there are elements of trying to understand some implications. So patient safety, ethical and legal issues can impact on patient safety. If they're not informed decisions, if they're not about their care, they're all necessary information, including potential risks. It can make choices for them, so it could harm the patient. So you've got to make sure that everything is ethically put in place. And the legal issues have a big, huge impact on that individual as well. Trust and confidence. Again, talking about trust and confidence, it can erode public interest if the public will lose their faith in the healthcare system if things are not dealt with. So there must be trust and confidence. Again, another one, professional accountability, and that is really important. Healthcare providers must adhere to the professional standards. They must have codes of practice, and if they don't, then obviously, there will be repercussions of that. If you're not having that professional accountability and accountability for what you've done, then there are legal repercussions of that. So that is a really important one as well. Resource allocation, making sure that resources are available for that individual, making sure that, resources are available. What kind of resources can be available? What kind of resources can be available or should be available?
Depending on the person's
Yes.
needs
It could be, it could be anything that could be available. It could be machinery, it could be, the
Yeah,
healthcare medication. All these are resources that are available.
yeah,
Then you've got health disparities, and that is ethical and legal issues contribute to health disparities, making sure that, you have a system in place that is structured to make sure that, it is meeting the needs of everyone. Healthcare disparities is one thing that needs to be met in regards to, meeting the needs of every patient. And, these principles are really important, and addressing these issues, is essential for providing, and promoting patient safety and ensuring that healthcare is effective. So we've got ethical contents, informed consent, professionalism, duty of care, and paternalism. So the first one is informed consent. And this is where patients had the right to make their informed decisions. So they have their own about their care. And, the place of the healthcare provider is to make them understand the risks and everything of that, if there's any risks or any alternative treatment. The next one is confidentiality on that table, which is, again, really important. Why is confidentiality so important? Protecting someone's privacy, is an ethical obligation. Why do you think it's so important?
Makes a person to feel dignified.
Yes. Yeah.
Everyone, they don't have to know what
Yeah.
is wrong with you.
Yes.
So
Nobody needs
yeah.
to know, only the organizations that are dealing with you.
Yeah.
So do you have to be careful, Mugarazi, that you don't send information about the patient to just anyone?
Yes, that means if you send information to the wrong person, you breach confidentiality.
Yes. Yeah. So you have to be really
it has
careful.
to be the right information to the right person.
Yeah, you have to
And
be really careful
you
of what
need
you
to
say.
do it in line to patient's interest, not
Yes.
your interest. Yeah.
Yes. The next one is a duty of care, and health professionals and everyone, you have a duty of care to provide an appropriate treatment for the individual, prevent any sort of harm, and it's all to do with the patient's best interest here. Then you've got the next one is autonomy against paternalism, and autonomy emphasizes a patient's right to make their own decision, even if those decisions differ from the healthcare professional. So, they might make a different decision to the healthcare profession. And then paternalism, on the other hand, involves making decisions on behalf of a patient, potentially overriding any preferences. Why do you think paternalism is making a decision on behalf of the patient? Why do you think that? When do you think that comes about?
I think
So,
it's for children
yeah.
and people maybe with yeah, I will say to children.
And do you think it'll be for vulnerable people as well that don't have the mental capacity sometimes?
Yeah, because
yeah,
if someone has got mental, they don't have capacity,
Yeah.
someone has to make a decision on
And if they
behalf
don't
of
have
them.
family, then then it would be up to the healthcare professional to make the best decision.
Yeah.
And then the next one is euthanasia and pain relief. That's obviously a big thing at the moment. Right to die with dignity. The law has been passed. It's just been passed, I think, 2 days ago on euthanasia. The person's right to die with dignity, and pain relief is like giving end of life end of life care. So it's up to that individual, but there's different views on whether the law should have been passed or not. And there's different views from healthcare professionals, and there's some people that support it and there's some people that don't support it, but the law has been passed 2 days ago.
they supported it.
Sorry?
The law supported it.
Yes, they've supported
Yeah.
it. They've passed the law to say euthanasia is allowed.
Yeah. I think it should be. Sometimes when they are like that in that condition or in that end of life, that some of them they are in pain or anything, so
Yeah.
anything like to
I
calm
mean,
them
sometimes I
down.
think euthanasia is a big thing when it comes to religious side of it.
Yeah, it does.
But for us, for me being a Muslim, and some, strong Christian and Catholic people would not
Yeah,
allow euthanasia because their beliefs are different. So
yeah,
religiously, it could affect religion, but it wouldn't apply to them people, So it's up to that individual to make the decision. So there's some, religious groups that are not happy, but there's some doctors that are not happy, because there's a procedure that you need to follow. It's quite a lengthy procedure. So that's just been passed. And then we've got genetic engineering, which is genetic raise ethical concerns about designer babies, genetical discrimination. And I totally disagree with all this genetic engineering and designer baby, design your own baby. It's quite it's not something ethically that I think is right. Cloning, and that's obviously the issue of cloning, the creation of a human life and the impact on human dignity. Then we have organ donation. Again, ethically, organ donation would include fair access to organs, and addressing conflict of interest if anyone wants to do that. Resource and health social care. This is the allocation of limited resources in health and social care, raises questions about the access to service and makes it difficult to make decisions. The next slide we've got here is to do with key legislation, and that looks at the different acts. So Human Rights Act, Equality Act and Care Act, data protection, which we'll go through in the diagram. So the key legislation here is the element of firstly, the Human Rights Act. What do you think the Human Rights Act is there to do? What do you think the Human Rights Act is there to do for individuals?
just to protect and care for those who doesn't have a say in maybe government or
Okay, so is it protecting? What is it protecting? Is it protecting their rights?
yes.
Yeah. So it's there, but it's the key legislation that it is there to protect individuals' rights, such as the right to life. It could be the right to freedom from torture, the right to private and family life. These are
Yeah.
things, and under the provision of care is protected as well. Equality Act 2010. Mogarazi, what do you think the Equality Act is there for?
Everyone should get a right to be treated equally, I think, without discrimination.
Yes, without discrimination, and it's got protected characteristics, 8 protected characteristics: age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex and sexual orientation. And these are various settings that would include social care, and that no one is discriminated based on any of them protected characteristics. So individuals are protected. Then we've got the Care Act 2014. Vida, what is the Care Act there for? Vida, no? So it's literally there to promote the well-being of adults and care and providing needing care and support and putting preventative measures in place for them and making sure they have ensuring individuals have a say in their care and planning. And then we have the one we've talked about a little bit earlier as well, data protection. Okay, is how your data is being handled, how your personal data is stored, how it's processed, and ensuring that individuals' privacy is respected and data is used fairly and transparently and not just sent to anyone. The next one is safeguarding. Again, safeguarding, really, really important part that is there to protect vulnerable individuals who are needing care, and also trying to protect them from any sort of abuse or neglect. And it is often guided by the Care Act 2014, and it's focusing on preventing harm and responding appropriately when it occurs. Okay, Health and Safety at Work Act. Nancy, what do you think Health and Safety at Work Act it is? Within healthcare profession, look at it from that aspect.
It's when it was protect or care for the workers.
Yeah, is it just workers or is it anyone?
Anyone who
Yeah.
is in that care sector, like
Yeah. Making sure that, the workplace is safe, doing risk assessment, making sure they've got training in place, making sure that, they've got a safe working practice. And if they're handling substances, make sure that everything is safe for them.
yeah,
Storage and handling of substances, what we just talked about, making sure the requirements are placed for controlled drugs and that they're able to be monitored and safely managed as well. And then the mental health capacity, that's looking at the providing support with people with mental health, making sure that they've got the freedom to do what they want, but not just to make their own decisions as well. Policies and codes of practice. So we've got policies and codes of practice in place. The first one is the national. Why do you think it's so important to have policies and codes of practice in place? And why is it important to, follow them and adhere to them?
Because if no, everyone will do anything they want to do.
Yeah.
But with code and policy, you have to do it according to the way the policy said you should do.
Yes. Because you are there to provide a high quality, a high quality kind of support for the individual and provide guidelines. So these have to be followed. So the first one is the National Health Service NHS Constitution. And this is a document that outlines the principles, values and pledge of the National Health Service in England. It defines the rights of patients and the public and the NHS staff and sets out responsibilities to ensure the NHS function effectively and fairly. And the Constitution aims to safeguard the core principles such as, free healthcare based on the need and high quality patient-centered care. So the main purpose is to provide patient care. Then we've got the Mental Capacity Act 2005. And this is for behalf of adults 16 and over who lack capacity to make decisions. And it aims to empower and protect vulnerable individuals by ensuring decisions are made at their best interest. Do you think there's been situations where people haven't been able to make decisions based on their mental capacity and their vulnerability?
yeah, I think so.
Yeah. There have been decisions and people have, made wrong decisions, but this is the main act for people that are vulnerable. It doesn't
Who
have,
lack that capacity.
sorry, what's that?
I say who lack the capacity, they can't do
Yes,
they can't
they
make
can't
their
do it,
own
no.
decisions, so they need
No.
that help to make
They
the
need that help, don't they? They really do need that help. Because, they may not have family, Nancy, So
yeah.
they need
Some
that
of them they
support and
don't.
help. And then we've got the NMC Code of Conduct, which is the code professional standards of practice and behavior for nurses, midwives and nursing associates, and it sets out the professional standards for nurses, midwives and nursing associates. It outlines what they are expected to do, their behavior, ensuring safe, effective and ethical practice. And the code has 4 key themes: prioritizing people, practicing effectively and preserving safety, and promoting professionalism and trust. Why do you think it's so important to be part of the NMC? Why do you think nurses need to know about keeping professional, maintaining, preserving safety? Do you think that's part of their job? Nurses and midwives and things like that. Do you think it's
Yes.
part of them?
Yes.
Yeah. The next one is the social commitment, which is the professional standards expectation of social workers. What that they make sure that everything is that they are related to respect, dignity, and make sure that care workers are able to provide high quality care. and it promotes the well-being and independence of all service users. We then have the Children Act, and this is quite an old act. It's a landmark piece of legislation in England, and it reformed the law relating to children, and a comprehensive framework for child protection and welfare. And it looks at the welfare of the child, promotes their upbringing, and outlines responsibility of local authorities. Why do you think this act is so important? And I think this is one of the main acts for children. It's the Landmark Act. Why do you think? What does it look at children welfare? What does it mean?
It's just really the abuse, because
Yes.
they have a kind of the children nowadays, like there's a child abuse going
Yes.
on
Yeah.
most
Yeah.
of the time. So
It's
he
protecting that
has to be
child,
there
isn't
to
it?
care for them.
Yeah. It's protecting that child, making sure it's that best interest of the child. And this is not just parents. It's the it's local authorities. You know,
Yeah,
it has to look at suffering, because there's been lots of cases where children have not been, they've been just brushed under the carpet, and they've died from that, negligence of the
yeah,
local authority, or even the law doesn't, the law is there for you to follow. And if you're not providing that high quality care, especially for children, and then, it would be an obligation that, is legally, it's breached the law. Then we've got the Adults Incapacity Scotland Act, which protects the welfare, property and finances of some adults. These include adults who have mental health condition or physical disability, which means they cannot communicate and not be able to bring things like make decisions or communicate decisions. So this would protect them, their legal rights and best interest of that individual who's vulnerable, who's not able to make their rights, okay? We then
yeah,
have the element of the Code of Ethics and Conduct for Social Workers. So the Code of Ethics is standards and expectations from social workers in Wales, including, again, respect, dignity, and person-centered care. And the Code of Ethics ensures that workers in Wales provide a high-quality care for ethical, and it's all about promoting the well-being and maintaining public trust in the profession, and make sure that everyone is dealing with the professional in the individuals with dignity and respect. So the next one is setting standards of practice and ethical legislation frameworks. So setting standard ethical frameworks are crucial, are very important for ensuring safe, effective, and ethical conduct within any profession in health and social care. And by setting these standards, they provide a foundation for professional behaviour. How you behave is really important, outlining expectations and for conduct, performance, and decision making. And also they ensure accountability to ensure that both public and individuals receive services. So standards need to be followed. Now, these bodies that are in place, people, nursing being part of the Nursing and Midwifery Council, they have to follow these code of conducts, don't they? Why do you think it's important that they are part of a body, a private body? Like the nurses have to be part of the Nursing and Midwifery Council, NMC, the Healthcare Professionals, HCPC, General Medical Practitioner Council is for doctors, GMC. Why do you think they have to be part of these bodies? Do they have to follow certain standards?
yeah, I think so.
Yeah.
Yeah,
They have to follow certain ethical frameworks. They have to follow codes of practice, things like whether they're competent, whether they're treating individuals with dignity and respect,
yeah,
confidentiality, accountability. It's all doctors and nurses. It's not just, they have to be part of it. They have to make sure that they are following the legislation and providing the best practice for that individual. It could be as a nurse, you will have your responsibility for maybe, treating the patient with, so that they can make their own decisions, no discrimination, so these kind of elements of having these awarding bodies is because we've got to follow the key codes of practice that are put in place for doctors, nurses, whichever healthcare professionals, social workers. So setting standards, we've got establishing the professional bodies and organisation, and then ethical frameworks is developing codes of ethics and conduct, and the legislative framework is creating laws and regulation, defining the scope of practice for different professions, incorporating ethical principles, outlining their legal requirements, what qualifications they have, what the register, how they register, developing clinical guidelines and protocols, and that's promoting awareness of ethical issues, outlining the legal framework. Outlining the legal framework of most of these is really important. Why is it important to follow the legal framework? And make sure we are, following that legal framework in regards to maybe people that are, vulnerable, or maybe people that are, why do we have to follow these guidelines and protocols? Why do you think it's important to follow these guidelines and protocols?
To make a right decision.
Yeah, to make the right decision. Developing quality assurance. Now, we have to make sure that, our complaints procedures, our disciplinary procedures are all established and put in place, and there are legal requirements, making sure that there's health and safety at work, manual handling of substances is all adhered to. Ethically, all this needs to be put in place. Promoting research and evidence-based practice, that is providing guidance on ethical issues, new technologies, new interventions, and outlining the legal requirements of resourcing for health and social care, funding, staff levels. All these need to be taken into account when looking at any sort of interventions or anything. The next one is the British Association of Social Workers. It's a professional association for social workers, this. And it's based in 1970, and it's there to support, protect, and inspire social workers in all roles and next generation. So it's there to develop professional ethics and also research and learning. And it outlines the values and principles that guide social workers in the UK. It emphasizes their human rights, social justice, and professional integrity, providing a framework for ethical decision making. And this code is regularly updated and remain relevant, and the key resource for social workers. Why do you think it's important to have one association that deals with just social workers?
So they can know where to go when there is any kind of issues, like they
Yes,
have one
yes.
place.
And make sure that they're following the policy of BASW, doesn't it? Make sure
Yeah.
they are, committed and respecting to any sort of human rights, and promoting any justice. Overall, it's the BASW Code of Ethics is really important is a vital document for social workers in the EU, providing guidance on ethical practice and promoting, human rights, social justice, and professional integrity. It helps support social workers understand what they need to do as part of their job, and it's really important. Code of
Yeah.
Ethics, Nursing and Midwifery, NMC. Again, the Code of Ethics for nursing outlines the professional standards and expectations for nurses, midwives, and nursing associates in the UK. It emphasizes prioritizing people, practicing effectively, and preserving safety and promoting professionalism and trust. They're the 4 key themes. And the code is structured around the 4 key themes and includes specific points, things like upholding dignity, respecting privacy, maintaining competence, and acting with integrity. So it's really, really important that this code is also followed. For nurses, midwives are expected to act in accordance with this code, and they must be accountable for their own actions and decisions. Don't you think this NMC code is what they must follow? And if they do something wrong, they should be accountable and no one else.
Yeah.
Yeah, because it's you can't blame another nurse if you've done something wrong. They must be also aware of any sort of potential risks to patients. You know,
Yeah.
they should, if they believe someone is being put at risk, they should raise concerns. They should protect sensitive information about the person. They should also, act in the best interest of that person receiving the care and respecting a person's decision. Now, if there are consequences where they don't comply with the code, they can lead to regulatory action by the NMC. It may be investigation whether they're fit to practice, and sanctions. And public, if it's serious code, it will be taken further. So, in place, I think it's good to have these association and professional bodies in place to keep people in line,
Yeah,
that they're not doing anything wrong. What do you think, Nancy, Vida, Mugari? Do you think it's good to have these associations and these bodies in place?
Yeah,
Yes.
it is.
Yeah.
Mm.
Why do you think it's good to have them in place?
Because if there is no anything they can look up to,
Yeah.
they might do anything they want, but it
Yes.
has to
Excellent.
be in
Yeah.
place to guide them
Yeah.
and
To guide
remind
them.
them.
And it's also to protect them as well, not just the individual, is it, Mugger? So, the protection is really important. The Code, Royal College of Nursing, RCN, and Principles of Nurse Practitioners. And these are encompassing aspects like professionalism, accountability, safety, and teamwork. And the guides nurses in delivering safe, effective, and person-centered care. The RCN's definition of nursing further clarifies these principles, emphasizing the role of nursing in healthcare improvement and ensuring the best quality of life for individuals. And there are 9 principles, that they must follow. And making sure that they define the core values. The whole point is that RCN's definition and principles of nursing are not just guidelines, but are fundamental elements of good nursing practice, shaping the way nurses interact with patients and colleagues and wider healthcare systems. So there's a need to have these professional bodies and these frameworks in place. The next one is we're looking at is discuss 4.1, discuss the key ethical and legal issues on our social care. So there are many key and legal issues within health and social care. Patient autonomy, confidentiality, informed consent. Informed consent is patients must provide with sufficient information about their condition and treatment options, including risks and benefits, and make sure they're informed about their care all the time. Confidentiality is another fundamental factor which looks at patient privacy and confidentiality, which is really crucial, and it fosters this element of trust and allows for open communication about health concerns. And then duty of care, you have a duty of care as a professional to the patients to make sure you provide a high level of quality of service and make sure patients are protected. Autonomy and paternalism, as we looked at earlier, is the principle of patient autonomy. And then paternalism is where they have to make, a decision based on the individual making their own, decision. This can involve decisions for individuals withholding information or overriding choices. So these are mental health capacity is anyone who has the mental health that is not able to make their own decisions and they don't have the capacity. And then end of life is what we've looked at a little bit, the right to end your life, but also euthanasia would fall within that. And the professional end of life is where they have the provision and the palliative care in place for them to have the, end of life care at home, if be. And then resource allocation. And without anything, without any of all of this, resource allocation plays a huge part of anything because you need resources, don't you? Within the health and care, social care profession, resources are a need.
Yeah.
If you have limited resources, you're not able to provide any services. So resources are a big part of this for health and social care. 4.2, explain the role of professional codes of practice within a health and social care setting. Professional codes of practice are a set of clear guidelines and standards and behaviours for workers, ensuring the safety and well-being and dignity of individuals receiving care. And these codes actually guide workers to fulfil their roles, make ethical decisions, and maintain professional relationships. And ultimately, they are there to promote public trust and confidence in the sector. So making sure that you have ensuring a high quality care, it's making sure that you are following the codes of practice, making sure that you have staff are being trained, making sure that it's efficient and they are providing a high quality of service that is safe, effective, and respecting the patient's rights and dignities, because that is the main thing. Promoting ethical behavior, making sure that you are promoting the different standards and you are, looking at navigating complex ethical issues to make decisions that ethically fall within the ethics. Providing guidance on legal issues, so making sure you are providing any sort of guidance on legal issues and making sure that you have, because you know that you have a duty of care to navigate any legal frameworks and ensure you are meeting your legal obligations, because that's really important. If you breach your legal obligations, you are not meeting them. Supporting professional development, any professional ongoing training, staying up to date, making sure you have new development. Why is it so important to stay up to date and, support professional development within any sort of healthcare professional?
Because things are changing these
Yeah.
days and everything need to be updated.
Yeah.
in
What
the
kind of
today
things do you
life.
need to keep
Yeah.
updated? Just an example of something, maybe?
Yeah,
What about
just
the changes in medication?
yeah,
What about
yeah,
changes
yeah,
in
the
maybe
changes.
blood pressure machines or anything, like that? Why do you need to keep up to date with all that?
Because
Because
even
if you come to
technology,
use it,
Yeah.
yeah,
you have to be on, you know how to use it.
Yeah.
So you
Because
won't
if
put
you can't
anybody
use
in
it,
danger.
yes, you're putting yourself and the patient at danger, aren't you?
Yeah.
yeah,
So you need to be staying up to date with any sort of new developments. You need to be continually improving your knowledge and skills.
yeah,
Attending CPD, attending training. Make sure you attend it so you're up to date. You're able to, provide that service, on any set of, new developments. You're able to maybe train, healthcare professionals, healthcare assistants on these kind of things. So you need to continually improve your knowledge and your skills. And it's good for you as well as an individual. If you want to move on to another organization, you would have the skills as well. Enhancing public trust. By adhering to any sort of codes of practice, you're demonstrating any sort of ethical, high quality care. And you need to make sure that you have enhancing that public trust. Why is it important to enhance public trust? Why do you think it's so important to make sure that the public have faith and promote this public trust and confidence in the sector? You need to make sure that, you are promoting public trust and maintaining professional relations and maintaining, and making sure that you are providing a high quality service all the time and, make sure that it's out there so that you are providing that. These codes of practices in health and social care are an important part of ensuring any sort of ethical and effective healthcare service and providing the best practices, ensuring that individuals are receiving, the high standards of care and you are following the professional conducts and providing a safe and effective and respectful environment for patients' rights and dignities, and make sure you are professional and you are held accountable for anything that you do. So maintaining the professionalism is really important within any sort of healthcare profession. So I think these are the references for today's session. Has anyone got any questions? So I'll just give you a summary of what we've been to in Learning Outcome 4. We've looked at ethical perspectives and underlying decision making, ethical context. We looked at informed consent. We looked at the element of duty of care, confidentiality, autonomy, and paternalism, contemporary ethical issues and decisions, such as end of life, genetic engineering, cloning. We looked at key legislation like the Human Rights Act 1998, Equality Act, GDPR, the importance of these. We also looked at policy and codes of practice, how they influence on health and social care work, such as the standards and the legal frameworks like the British Association of Social Workers, BSW, Code of Ethics, Nursing and Midwifery that we needed to follow, and why these are so important. So we've looked at the element of understanding all the ethical elements of that, and looked at understanding the implications of ethical and legal issues within health and social care. Has anyone got any questions? These are some of the references that you've used in today's session that you can link on and use. Refer to ebooks and journal on Moodle that you could go to further reading. There's some links there on standards, conduct and performance. Ethics for healthcare regulators, there's a link there. Any questions or any queries is on Learner Work and at ukvarsity.co.uk, and submission of the assignment would be done on that as well, which we'll go through more next week. So your assignment discussion is next week because we've finished the 4 learning outcomes. The 4 learning outcomes will be all recorded and put on Moodle for you, and any sort of ebooks or any sort of extra reading is all on Moodle for you to refer to, okay? And the assignment brief will be available also on Moodle. We'll have the assignment discussion next week where we'll go through the assignment and discuss what is expected of you in the assignment. And you have 2 weeks to do that assignment, and you have to submit that on Learner Work at ukvarsity.co.uk. Any questions before we finish today's session? Nancy? Mugare? Nisa? Vida? Any questions?
Not really, but it was nice.
No, really.
So learning.
Thank you. Thank you for attending today's session. And the next session is our last session, and it is on the assignment discussion, okay?
All right.
Okay.
So please go on to Moodle and have a
Yeah.
look at Moodle on the assignment brief, and we will discuss it further next week in more detail, okay?
Okay.
Thank you for attending today's session, and everyone have a nice week.
You too. Thank
Thank
you.
you.
Same to you.
Bye.
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 Bye, everyone. Bye.